Hi everyone, this is Kristen Darcy and I am so excited to be here today on June 15th, the first day, Monday of Making Dad Summit. And once again, Sara is with me and we're kicking off this conversation about men's health, male infertility. And we have today with us the wonderful Dr. Chen is with us. Hello, everyone. I'll say hello to Sara. Sara, come on, drop in.
Hello.
And Dr. Chen is also with us right here.
Hi, how are you?
So what today we're talking about on our Monday, we wanted to begin with hormones. And the topic today is testosterone, estrogen, sperm, and what every man needs to know about his hormones. And you know, it's kind of mainstream conversation about women and their hormonal issues. So that's why I'm so blessed to have you with us today, Doctor. And before we get started, I just wanted to read your a little bit about you. And so Dr. Chen graduated from Brown University here in Providence, Rhode Island on the East Coast, yay, and then attended Duke University School of Medicine in North Carolina, where she caught her first baby and decided to become an OBGYN. And of all the wonderful things in the field of OBGYN, she finally decided she was most fascinated with the world of test tube babies and IVF, or in vitro fertilization. So she decided that she would specialize and become a board-certified reproductive endocrinologist, and she's practicing today. So it is such an honor and a privilege to have you here and sharing your wisdom with us. And of course, your contact information will be under your name during our talk so that people can jot that down. But welcome. Thank you, everyone. And ladies, I'm excited to start our conversation about the men in our lives and help them to be healthy. So I think we're going to talk about testosterone to begin with.
Right.
The big T.
So,
yeah.
So I, getting into male fertility and learning about it, I was very fascinated with how much your hormones actually have to do with your reproductive health. And I don't know if we all know that, but I was totally floored by that. And Dr. Chen, you're a endocrinologist, which is the study of hormones. So maybe we could just start with some basics. What are our reproductive hormones, and particularly what are men's reproductive hormones? We all have heard of testosterone, but there are other ones. What are they and what do they do?
So hormones are very interesting because they affect every single cell in the body, and your brain is actually involved in your hormones. So both men and women have these hormones in the brain called GnRH, gonadotropin-releasing hormone. They have FSH and LH, which then act upon the gonads, and in men that's the testicles, and women that's the ovaries. And the FSH and LH travel through the body and stimulate egg production in women and stimulate sperm production in males and testosterone production. And then when the testes, so the testes have two jobs. They make testosterone and they make sperm. And sperm, of course, are for making babies. And testosterone is for maintaining men's health. And men actually also need estrogen as well. A lot of people don't realize that the growth spurt that boys experience during puberty is actually mediated by estrogen. So the estrogen actually helps the bones to grow. And testosterone, of course, does things like help with sexual function, erections, ejaculations, muscle tone, muscle building, and affects your metabolism as well. So there's a whole complex interplay between the brain and the testes that make sure everything is working well.
So for guys, it really is true that their head and their balls are connected.
Yes, yes, that's very, very true. Very true.
So they're not making it up. They really do have a biological link between their head and their balls. That's
Yes,
I think that's really a good take-home message.
So that is interesting where, like for men, a lot of couples that I work with are struggling with infertility, and we see that stress, of course, affects women, but it can affect men as well. And we have a lot of our infertile guys may be experiencing things like erectile dysfunction and ejaculatory dysfunction, and we send them for checkups, and it's not necessarily a mechanical or a physical issue, but they are they can experience tremendous amounts of stress, and stress can affect your sexual function. So that's always one important thing to consider when we're thinking about those kinds of issues.
Interesting.
That's the stress of this all, of course, is the emotional component. And at the end of the week on Friday, we have our Thursday and Friday, we're really addressing the stress on men's health too. And that, of course, is, the emotional component and how men and women choose to deal with that emotional trauma of this. And to be honest with you, that's why Sara and I started this conversation last year, was because exactly what you talked about, Doctor, was that a client of mine, this amazing, big, huge, burly man, was diagnosed with male infertility, and he just broke. And it was as if that, the shame of it was so overwhelming for him. And, that's why I so appreciate you bringing that right out in front, because that was the inception of this whole conversation. And, of course, Sara, I called her and I'm like, I'm not doing enough. I'm not doing enough for the male clients about the stress. But so
it's hard because guys don't really like to talk about it. So we have to, when we talk about stuff like that, we have to be sensitive to that. So I think this is wonderful that you guys are having this whole Making Dad Summit, because this getting it out in the open and making it part of the conversation, I think, will hopefully normalize it, and people will realize that, they're not alone. They're not struggling with this by themselves. They don't have to just tough it out. There's resources like you guys and your website, our website, all kinds of experts out there to help them with not just the medical, but also the emotional, and just, I think, knowledge and understanding definitely are one of the first steps to helping with like the stress of it all.
Right, correct. So
interesting.
Oops, go ahead, Sara.
I was just curious. You talked about stress. Does stress alter your hormone profile, or can it?
I think it would be hard to actually measure that. So can stress cause measurable hormonal changes? Actually, only in really extreme cases, like where somebody is in a war and they're starving and things like that. So it's not so obvious. We think that stress has more subtle impacts, like affecting your cortisol system,
Right.
which doesn't cause such overt measurable things. It's not so easy to measure hormones, because hormones tend to fluctuate throughout the day, and that's really important when we're measuring testosterone, because there's a lot of falsely low testosterone measurements that are done, because testosterone is one of those hormones that goes up and down, and your testosterone can be completely normal, and if you just do a random level, we can come out with a low level. That doesn't mean you have low testosterone. Low testosterone is actually really kind of tricky and difficult to diagnose. So we do think that stress is having physiologic impacts, probably through the cortisol system. We don't think that stress actually will directly cause low testosterone or low sperm count, although obviously it can affect erectile function and ejaculatory function, but it's a little more subtle than that.
Okay.
So we don't like to tell people that they're having infertility because they're stressed out.
Right, because but would a way of saying it be it contributes to sub-fertility issues, that if the high stress level.
Yes.
Go ahead, sorry.
I think so. I think so. And we of course know that high stress affects general health, and general health has a huge impact upon reproductive health. So it's a little bit of an indirect effect, and stress is not a good thing. But at the same time, I don't want people to feel to blame themselves for
Right,
their own medical problems. You know,
right,
stress is a natural outcome of this, and you deserve support and help, and you shouldn't be beating yourself up. And you know, because there's that common theme out there of, oh, you don't worry, you guys will get pregnant, just go take a
right.
vacation and you'll be fine. You know, it's all in your head. It's definitely not in your head.
No,
um,
no. And
so
there's a there's a physical chemical reaction to a stressful environment, and it's situational
absolutely,
stress. And
absolutely.
so if you were to have, if I would love for you to continue and talk about the estrogen and the sperm productions, but if you were to share to the men that are listening what to expect when they come into your office, because I think a lot of the stress of having is the unknown, you know, the unknown of what will happen
Yeah.
when they go to a reproductive endocrinologist.
I think it's really stressful for the guys because I'm a gynecologist, and the women I see, even though they're very stressed out and upset about not getting pregnant, they go just every year. So they're used to coming in and seeing the doctor and going through the routine. Guys are not really used to that. And guys don't seem to go to any doctors at all unless they're, you know, having chest pain and they think they're having a heart attack. So
Or bleeding.
that's one of the issues is
Bleeding, yeah, unless they're
they're just not
shocked.
used to coming
Or
to see the
bleeding or
doctor.
shot, right? That's
Yeah.
what one of the doctors said last
Yes.
year. Guys
Yes.
don't go unless they're shot. You know?
Exactly. Exactly. So, you know, when they come in, they're usually dragged in by their wife who, because we tell them we like to see you as a couple. You know, I don't know if you can see in my background there, I got a little baseball picture. I'm a big baseball fan. So I got a picture of Robinson Cano with Jason Varitek from when he was on the Red Sox, and Robinson Cano when he was in the Yankees. I I have some baseball pictures up because that's a little bit of an icebreaker. I want the guys to feel a little bit comfortable. I have all my diplomas up on the wall. The guys also seem to like to talk about um, my training and know that, you know, I'm not just from, you know, I'm not just a Joe Schmo. I actually went to medical school and all of those kinds of good things. So we went at the beginning, it's just a conversation. Everybody's totally dressed. Everybody just sits down. We sit down at the desk and we talk about the why they feel like they're here and what they want to do and what they're worried about. And then I like to go through and talk to the guys about stuff like smoking and drinking, their weight, their diet. I do encourage all the guys that come to me to actually go to see their primary care doctor for a wellness visit. I think in the past we always thought of doctors, you go to the doctor when you're sick, and I think guys still do that. I think we're starting to change. Finally, doctors are starting to change how we think, and we think we're not just trying to save somebody from dying, it's trying to uh, help illness. We're trying to help people live a better life and be healthier. And that's what I tell the guys. I say, you know, there's just this very recent study of thousands of men in California done by Stanford, and they see that men with infertility do have slightly higher rates of general health issues like diabetes, high blood pressure, heart disease. And I think it would be a good idea for you to go see your primary care doctor and just get a checkup, just get a tune-up, and ask them, how can I be healthier? Because I think that's going to be good for you. It's going to help you be a healthier father, and it's going to make this treatment go better. And most of the guys are really, they're very open to that because I think men tend to feel like they're tagging along and they're not really sure what to do with themselves, and they really want to participate and they really want to help out and contribute, but they often feel a little bit lost and uncomfortable about how to do that. And so you know, I tell them, this is, you know, I need you to do this. I need you to quit smoking. I need you to lose weight. I need you to have a healthy diet. Um, maybe the two
The
of you should go
imbalance,
see the
basically.
therapist together. You know, like these are things that you can do and to help yourself, help your wife, help your family. And I think the guys really, that is very helpful. That's to be able to um, provide a little bit of control, because that's part of the
Right,
infertility journey, is that loss of control. That's
right.
one of the most stressful parts.
So when you suggest for them to go get their, their yearly physical, 'cause even though they're not bleeding, because that's when they need to go, do you
Yeah.
encourage their primary care to do a blood testing of the hormones then?
You know, honestly, I actually would not recommend that
Okay.
unless somebody has an abnormal semen analysis, because the best test of hormonal levels is looking at the patient. So I can see if I'm sitting with a guy during a consult, I talk to them for half an hour, and within that half an hour they go from clean shaven to they got a shadow, and I can see all those muscles. I know he does not have clinically low testosterone levels.
Okay.
So I don't think we should create problems by, maybe measuring testosterone and getting a falsely low testosterone. If somebody is not having erectile dysfunction, ejaculatory dysfunction, their energy is normal, their muscle tone is normal, they're shaving, at their regular frequency, then they are okay. On the other hand, if you're tired, testo, you know, this is one of the issues that we face, is that a lot of guys who are just tired and stressed, sometimes they're given testosterone prescriptions as kind of an easy solution when it might, be a more complicated thing. So I do try to talk with the guys about that. I mean, I did have a guy come in to talk with me once, and he was a bus driver, and he had a couple other jobs like doing security at night. I mean, this guy was working like 100 hours a week, including night shifts, and he had gone to his doctor and told him he was tired, and the doctor had given him testosterone, and I was like, did you take it? And he's like, I didn't take it because I was kind of thinking maybe my testosterone wasn't low, maybe it was because I was working 3 jobs,
Jobs.
and I was like,
Right. So
good
it's
for you.
life. Life is a
And
busy life. Yeah.
and this is a big guy, a lot of muscles. He's shaving every day. That guy did not have low testosterone, and the testosterone, of course, would have made him infertile. So I do want the guys to. There's a lot of advertising about low testosterone, and I think honestly, the prevalence of truly low testosterone is relatively low. And a lot of people have low testosterone, and the solution is not a pill. The solution is, you're 50 pounds overweight. All that extra gut, talk about estrogen, that's an estrogen factory. So you got that big gut, all that fat, making lots and lots of estrogen, converting all your testosterone into estrogen, and just lowering your testosterone levels. If you get rid of that gut, then your testosterone levels are going to be significantly higher, and you're going to feel a lot better, and your sperm is still going to be good. You're not going to be taking a pill. Maybe you should quit smoking. Maybe you should exercise a little bit. Um, Often those are the most common causes for low testosterone, is honestly obesity and just poor health.
Right. So it's really looking at your lifestyle as in imbalance, or if it's out of balance. And that gentleman that came and was working 3 jobs and was a bus driver, immediately go to the fact that he was sitting down all day, and the heat in the kitchen
Yep.
down below is a factor too, right?
Mhm. Mhm. Yeah, exactly. Although, I don't want people to, you probably don't want to be biking 10 hours a day, but just because you're wearing, you can still wear bike shorts, and, you know, you don't have to wear boxers instead of briefs. Those things don't actually increase scrotal temperature. Although just being really, really overweight probably does increase scrotal temperature. And of course, dipping your testicles in directly into hot water is really bad for them. So we always tell people to stay out of jacuzzis and really hot baths.
So, a question: if I'm
Yep.
a guy who has not yet been evaluated, and we're just very early in the conception journey, but I'm watching those low T commercials, and I do feel like a lot of those things apply to me. Is it a valid thing to think that I could have a fertility issue if I really feel like I have a testosterone issue? Should I be coming in earlier to get evaluated?
I think so. I think if you have those kinds of symptoms, you definitely should be evaluated, and probably going to a primary care doctor is a good idea, but because low testosterone in somebody who wants to conceive can be complicated, it's probably also good to see a fertility specialist as well. A reproductive endocrinologist for you as a couple, and maybe a reproductive urologist, because we do, sometimes people do need hormonal treatment, and the way to that we would treat a low testosterone, true low testosterone, if you actually need hormones, is not to give testosterone. That's because giving testosterone basically tells your testicles to shut down. So they stop producing testosterone on their own, they stop producing sperm, and you can actually get a physical shrinkage, atrophy, or dying of the cells in the testes. So the way we actually treat testosterone, low testosterone, for people who want to still be fertile is you do it indirectly. You maybe give some of the brain hormones like FSH or HCG or those kinds of things that actually will stimulate growth and health of the testes. Clomid and there's a new form of Clomid, which I'm blanking on the name right now, and aromatase inhibitors are all different medications that work by treat raising your hormone levels in your brain to stimulate uh, the growth of the testes, and you're stimulating not only testosterone production but also sperm production, whereas directly giving testosterone just tells your testicles to shut down. So that's a much safer way to treat truly low testosterone.
And it seems like you were alluding to this, that some of the real kind of persistent signs of low testosterone are things like reduced hair growth, reduced
Like
muscle.
you're not shaving, yeah, and muscle atrophy, yeah. Those are, those are situations where you're concerned, like, yes, something is really, really happening. If you're tired but you're, shaving every day and your muscle tone is okay, it's much more likely to be something else. The other thing is it's just also a numbers game. The prevalence of other causes for just feeling tired and not yourself are, because those are such non-specific symptoms. Testosterone is only a very small portion of the causes for like just not feeling well and feeling tired and all of those kinds of things, and lower sex drive. Sex drive in guys is mediated by testosterone, but it's also affected by many, many other things, and so um, you have to think about
The
the
whole,
whole person,
the
and
yeah.
yeah.
So you mentioned that smoking and exercise and alcohol and being overweight, all these things can contribute to increased estrogen or low T or just generally feeling bad. Um, and do you see in patients that take that advice, to heart and lose the weight? Um, do you see improved fertility, and B, do you see improved other outcomes like improved sex drive, improved erectile function, better
I think you
well-being, etc.?
definitely the biggest benefactors are things like sex drive and an improved sense of well-being. It's hard to see measurable differences in semen analysis from those types of things. Quitting, the data we have on like smoking is very powerful, but we don't see necessarily actual measurable differences in the semen analysis. What we see is that if either if either partner is exposed to smoke, even secondhand smoke, nobody has to, neither male or female has to smoke, but if one of them, even if it's only the male, exposed on a regular basis to secondhand smoke, that couple will have a much higher rate for infertility, miscarriages, and even birth defects. So we know the smoking effects are quite powerful. It's unclear exactly how they're mediated, perhaps through the DNA of the eggs and the sperm, and you don't necessarily see a low count or those types of things. So it's not quite as easy to measure. Obesity is the same way. Alcohol, very interesting recent study with alcohol. Alcohol in moderation for guys is fine. And when we say moderation, we say this very large recent study from the Lancet a few years ago looked at couples and their alcohol habits, and they saw that if either partner, either the male or the female, had on a regular basis more than 3 servings a week of alcohol, that they just had higher rates of infertility. They didn't say like low sperm counts or anything like that. It was just generally a population-based correlation that they saw higher rates of infertility. And, cutting back a little bit on your alcohol is something relatively easy for most people to do. And most of my patients are really happy to be able to do something really concrete that is associated with better numbers. So that's something I like to tell all couples, is that less than 3 drinks a week guideline. And when we say 1 serving of alcohol, we mean like 1 beer, 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of hard liquor. So that's considered 1 serving. And if you're, every once in a while you go to a wedding or a party, that's not what we're talking about. We're talking about on a chronic long-term basis, trying to keep that to 3 drinks a week or less for both partners.
That's important, because some of even in my personal coaching, there's not a connection to that, what you're taking in and how that affects your ability to conceive. I always talk about that you're inviting this other person to come in your body, and you're creating a space and an opening, and down the line, the healthiest dad or the healthiest mom is going to create a healthy family. And so that's so important, because that might be an aha for someone who's trying to create their family about alcoholism, alcoholic beverages. So that's
well, and 3 drinks a week is really a little bit less than moderate, because most of us think of moderate drinking as, a glass of wine a night, and that's, 7 servings as opposed to 3 servings.
right.
So it's nice to give people like some concrete guidelines that's actually attached to real data. So that's why I always like to tell people about that particular study. So, and I do think that people are looking for that. They're looking for just, some practical advice, because I think, people do want to be healthier, and sometimes it's hard to figure out exactly how to do it. It can be overwhelming a little bit.
What that looks like and how you can implement that. And what about caffeine? What about caffeine intake?
So caffeine, there's a lot of data on caffeine and women. So I do always tell the women to cut back on caffeine. The guys, there's actually not really a correlation between caffeine and I always feel like I have to be careful, because the sperm actually like caffeine, because when we wash the sperm, we actually give them a little bit of caffeine in the washing to pep them up a little bit. But I don't want guys drinking so much caffeine that they're hanging from the ceiling and howling. So we really have to be careful.
You don't want them running out to get a Red Bull, right?
Yes, exactly.
or a triple.
Yes, exactly. So I always tell people, coffee and tea are good for you because they have antioxidants. For the guys, a little bit of caffeine is okay. Too much caffeine is bad for your heart. And coffee and tea are good as long as you don't put like a lot of artificial sweeteners, which are just bad chemicals for you. That's just bad for everybody. And you don't put too much sugar in, because then, like 1 teaspoon of real sugar, that's probably plenty. And a couple cups of coffee for a guy every day is not a big deal. Probably 5 to 10 cups is really a bad idea for your heart. And definitely Red Bull and sodas are bad because they're full of chemicals
And
and sugar.
sugar. Yeah.
Yeah, just way too much sugar. And we want both our men and women to be on a low glycemic index diet. So too much sugar is bad. And it's not that carbs are bad, it's just that there are good carbs and bad carbs. Sugar is one of the bad carbs, and good carbs can be found in vegetables and whole fruits and whole grains. So we're trying to get people to do more of that kind of diet as opposed to a more sugary diet or something filled with like a lot of pasta or rice or bread.
That's so important. It's just talking about awareness of, imbalance in your body. And in no way are we saying, by having a little cookie, it's all moderation, like you said, with the wine.
Yes, it's all moderation. You don't want to go crazy, but I think as a physician, I have all these high-tech tools to be able to make babies, but if somebody is really unhealthy, the success rate is definitely lower, and the complication rate is higher, and miscarriage rates are higher, and birth defect rates are higher with couples who have health issues. So, and these are things people can really change their
Right.
outcome and their long-term health. It can really make a big difference. And I think couples that are trying to conceive or thinking about their fertility are really motivated. So it's kind of nice that they can get healthier at the same time that they're getting treatment.
So I think that it's so informative, all the information that you're getting, and at the end, maybe we can just do 3 action items that might supercharge their fertility, and you already listed so many. So your first one that you said, you really need to go to the primary care and get a physical, and we talked about the blood test and that that's not necessary. So when does the semen analysis come in? After the physical, and they have the results and they share that with you, and
so usually what we do, and every practice does this a little bit differently, but we don't attack the guy at the first visit and hand him a cup. We talk about, at some point you're going to do a semen analysis, and usually we check blood work first because we do a lot of blood work at the first visit after we sit down and talk, and the blood work will address specific health issues, and then we do routine blood work that we do on everybody. So for guys, we're doing checking for hepatitis and HIV, which just is a general recommendation for all couples trying to get pregnant. We check for CMV, which is a virus that can cause the common cold, but it seems to hang out a lot in sperm, and if somebody has a guy has an active CMV infection, we don't want them to get pregnant right away because that could create an issue, even though it's a virus that is not really going to cause the guy a lot of harm. So we check for CMV. And once we get the blood work back, then usually we have the guy call and set up the semen analysis appointment. And for the semen analysis, we usually have the guys produce the specimen by masturbation into a cup. And most of my guys are producing at home if they live relatively close and can bring the specimen to the hospital. Some of my guys are very shy and their wife brings the specimen to the hospital. But we also have a production room that's private, and our guys can come to the production room and produce a specimen by masturbation into a cup in the production room. So that's the most common thing. I do have some guys that really don't feel comfortable with either of those options. Some people who don't feel they cannot produce a specimen by masturbation, or they have religious concerns about producing a specimen by masturbation. And then we have something called a condom collection kit. That's a special condom that's not toxic to the sperm, because because a lot of commercial condoms tend to have like toxic gels and things like that that the sperm don't like. So we'll have a special condom collection kit where they can have intercourse with their partner, and the ejaculate, of course, will go into the condom, and then the condom can be put in the cup and brought to the lab for analysis. So that's the most common way that we do the semen analysis. And a lot of guys feel uncomfortable with that. We try to make it, as easy as possible for them, giving them a choice about where they're producing and all of those kinds of things. But that's one of the really basic parts of the fertility analysis.
Sarah, did you know about the condom? I haven't heard about that. That's news to me.
Yeah, I know. I know quite a bit
Sarah
about
knew about that.
I thought you would know about that. You're in the know, more so than me.
Yes.
It's not used very commonly because, like she said, it's much better to, for a sample processing perspective, to get it by masturbation, to get it directly into the cup. You lose some volume when you're transferring from a condom into a cup. You lose some sperm. You lose stuff. But again, it is very hard for some guys to, take that cup and deal with that.
Right.
So something is better than nothing. So the condom will give you something, but the cup will give you, I think, a better analysis.
Right. That's wonderful. Well, I would love for you just to share how people watching us in our conversation can get a hold of you. What would be the easiest way? If they have any questions after watching.
Absolutely. We have my website is up here, www.sbivf.com, and I'm at the Institute for Reproductive Medicine and Science at St. Barnabas in New Jersey. We have offices all over New Jersey. If you go to the website, we've got phone numbers there. We also do a lot on social media. So, we have a Facebook, and I have my platforms, and we have Pinterest and Instagram and Twitter. So we'd love to for you guys to contact us and follow us that way. All of my feeds are under Dr. Serena H. Chen. So under Twitter, it's Dr. Serena H. Chen, and Instagram. And again, all those links are on the sbivf.com website for stbarnabasivf.com.
I would plug that Dr. Chen also does an incredible job of tweeting out research as it comes in. So I have a really great pleasure reading her feed. And if you want to learn more about the latest things, she's always tweeting about it, and she's just great.
Awesome. And of course, you can find Dr. Chen's contact information on Making Dad Summit homepage. And this is Monday, so we're so grateful for your time and wisdom, and thank you for sharing in our conversation. And Sarah, thank you
Thanks for having me.
Being part of this conversation again, and we look forward to connecting people who need help to your company. So thank you so much.
Thank you.
All right, bye.
Have a great day.
Have a great day.
Bye.